Welcome back to Great Bay, Louisiana. We are here at Ochsner today because take a look at this. In 2019 alone, Ochsner saw 32,000 adult and pediatric cancer patients alone. And let me tell you, since this renovation, they're going to be able to do a lot more. I'm standing here at the Gayle and Benson Cancer Center at Ochsner, and joining me now is the medical director of the Ochsner Cancer Institute. Please help me welcome Dr. Brian Moore. Hello.
Hello. Nice to be here. Thank you for being here.
Thank you so much. It is beautiful. I got a tour of the newly renovated space. It is amazing. For those who do not know, tell me about some of the new features.
Yeah, it is truly amazing. I mean, it's a great day for Ochsner, and it's a great program for the region. So we have always had one of the stronger cancer programs in New Orleans and the Gulf South, and this expansion is allowing us the space to deliver that world-class multidisciplinary care in a manner that is easy for patients to access, that's easy for them to park and come on right in, but they meet with the whole team. And I think it's the consolidation of our programs in one area that is truly amazing. And so there are some, our philosophy, and I know we're going to talk about that in a little bit, is this multidisciplinary, disease-focused cancer care driven by experts with a foundation of clinical research.
It is amazing, and I know you all have so many different new specifications. Yep. How much bigger is it now? It's like 115,000 feet now?
It is, yeah. It's 115,000 square feet. It's 6 stories. It more than doubles the size of the existing cancer program. And so if you look at the index right by the elevators when you come in, you'll no longer see departments. You'll see head and neck cancer program. And so we're providing space for those teams to meet with patients.
Which is very important. And I know you all have so many other different things. You all have that O-bar. You also have some multi-clinics. You also have some cool breast cancer clinics and new chemo stations. I believe you have 58 now?
58, yeah, 58 new chemo stations. We're standing here on the 3rd floor, and this is the home of our integrative oncology clinic, where we offer consultations with an integrative medicine specialist, Dr. Liz LePere. And then we also offer acupuncture. We have space for meditation. We have space for yoga, for Tai Chi, for support groups to meet, and even a drop-in physical therapy area, because a lot of the things that we do, whether it's the drugs that we give, the surgeries that we perform on patients, they all have side effects.
Now, doctor, I know there are many different ways to treat cancer. Are there any new approaches you all are adopting to help in cancer treatment?
For sure. So in addition to the core principles that we follow here of multidisciplinary team-based care, we have the region's only phase 1 clinical trials program, which is called the Precision Cancer Therapies Program. And it's led by Dr. Mark Matrana, and it brings oftentimes drugs that are first in human into clinical trials for patients with advanced stage cancer. And it's truly a remarkable program. These are our clinical trials that patients traditionally would have to travel to Houston or Alabama, to Birmingham, to be eligible for, to be put on. And we're able to do that right here in New Orleans and keep patients closer to home. In addition, in our prostate cancer program, we are one of 4 sites in the country that combines a new high-intensity focused ultrasound probe with an ability to ablate or destroy in a targeted fashion prostate cancer cells, and we can do that right here in the Cancer Center.
And what I think is great is that overall you all have a great idea of making sure that the social, the physical, as well as the emotional impact of cancer care is handled here at Ochsner, which is great. And of course, you all need monetary support. We cannot thank Gayle and Benson enough for their support. But there are also some ways that myself, as well as viewers out there, can also support you all. Tell me about the Text to Give program.
Sure. So real quick, we wouldn't be here today if it weren't for the generosity of Gayle and Benson. So everything that they've done for this program, we very much appreciate, and they're really helping us change and save lives. But we have a couple other opportunities for anyone to give. And so we do have a Text to Give program. It is a way that you can text Ochsner to a defined number and work out with our philanthropy department a way to easily donate some money. Every year we have our a big fundraiser. Typically that's done at the Superdome, about 2,000 people. This year it's a virtual event. It's going to be still a lot of fun. We're selling tickets for that. There's a great meal that's involved, and we also have a raffle where you can win a fancy new Mercedes. There's only 1,000 tickets being sold, and they're $100 each.
Thank you so much for joining us
Happy
this morning.
Happy to be here.
Absolutely. Thank you for all the work that you are doing. And hey, if you want more information about this beautiful new cancer center, they are now accepting and treating patients right now with the latest technology, with compassion and a team approach that is close to home. For more information, you're seeing all of it on your screen right here. Ochsner.org/cancer-care is the website, or come visit them at 1514 Jefferson Highway right here in New Orleans.